Good afternoon. Welcome to a special edition of MEED Live. Today we are running the Innovation Live Healthcare Challenge. The purpose of today's discussion is to look at the UAE healthcare sector and look how innovative thinking and innovation policies can be used to develop the UAE's healthcare sector to achieve the country's Vision 2021 targets. I'm joined today by a panel of UAE healthcare experts. At the far end of the panel we have Daniel Whitehead, who is the Director of Medical Strategy for Daman Health Insurance. Welcome, Daniel. Sitting in the centre we have Dr. Osama El Hassan, who is the Head of eHealth at Dubai Health Authority. Welcome, Dr. Osama.
Thank you.
And on my immediate right we have Prasant Mangat, who is the Chief Executive Officer of NMC Healthcare. Welcome.
Thank you.
I would also like to welcome viewers from the NMC and from the MEED Facebook Live communities. Welcome to all of you who are on cameras elsewhere around the room. So let's get started. The UAE has set out an ambitious innovation strategy that is seeking to drive the country forward in 7 core sectors, one of which is healthcare. And under the Vision 2021 targets, the UAE is seeking to elevate its healthcare sector from its current ranking of 28 in the Legatum Prosperity Index up to a ranking of 20 by 2021. The Legatum Prosperity Index looks at physical and mental health in a country. It looks at healthcare infrastructure, and it also looks at preventative care. So it's a very holistic index, and it's been used by countries around the world to measure effectiveness of healthcare. So we have these ambitious targets for the UAE, and the panel today is going to look at how can the UAE achieve these targets. If you want to get involved in the conversation, you can submit questions using the screen in front of you. There is a text field underneath the screen. Please send in your questions. They will come up on my computer and I'll put your questions to the panel. You can ask us about anything, but I would ask that you try and let's keep it focused for today on innovation in the healthcare sector in the UAE. So let's get started. I think Dr. Osama, as a representative of government, I would like to start with you. Perhaps you can tell us a little bit about what is Dubai Healthcare Authority's responsibility for innovating healthcare in the UAE?
Okay, so let's start with Dubai Health Authority. Dubai Health Authority is a government sector institution. Actually, we play 2 roles. So actually, we are the service provider, the government service provider for healthcare. So we have around 4 hospitals and 23 medical centers around the Emirate of Dubai. And also we regulate the private sector as well. So we are responsible for both.
So you're provider and regulator.
Yeah, exactly.
And you are specifically responsible for eHealth.
So yeah, I'm responsible
eHealth?
of eHealth under the a department called Health Data and Information Analysis Department. So we are part of the strategy sector so we are part of the regulation side of DHA. So we look after the private sector in general in terms of licensing or whatever. But our department looks into data and looks into the connected care.
Okay.
So this is our core responsibility.
So in terms of big data and artificial intelligence and all the innovative stuff,
and all technologies,
area.
Like I give you one example, like for example, telemedicine is one of our core responsibilities.
So if you are interested in healthcare innovation, big data, how the UAE and Dubai in particular is approaching this, Dr. Osama is here to answer your questions.
And I'm also a member of the innovation team in DHA, which is part of the new strategy, DHA strategy for 2016, 2020, 2021.
Well, thank you for being part of our panel today. Daniel Whitehead, you are from Daman Health Insurance. That's Abu Dhabi government owned or part owned health insurance provider, the biggest insurance provider in the UAE. You are Director of Medical Strategy. So can you tell us just briefly, where does Daman fit into this kind of innovation in healthcare story?
Sure. So Daman was set up almost exactly 10 years ago. We celebrated our anniversary just this past year. It's partly owned by the government of Abu Dhabi and is a joint venture with Munich Reinsurance. So it brings a lot of the innovation ideas from Europe as well. We have about 3 million members, which makes us one of the largest, I think the largest local insurance company in the UAE. And medical strategy, what we try to do a few things. We're not the corporate strategy department, so we don't look at new products or we don't look at things like market share. We focus on the money that Daman spends, which is largely government resources, because many of our portfolios pay for healthcare of UAE nationals. There's also subsidized plans for low-wage employees. So we take our role as the steward of government funds quite seriously. We try to use data, to use innovative ideas, to understand how that money is being spent, to ensure that it's spent efficiently, and also to make sure that it's spent on getting value for the money.
Excellent. Well, thank you for joining us today. Prasant Mangat, you're Chief Executive Officer of NMC. Now, NMC is one of the world's big private healthcare providers, but you have a huge history in the UAE, 44 years. What are you up to today? What's NMC's kind of, what's driving your activity at the moment?
So to give you an idea, that NMC has been in UAE from 1974. So we recently celebrated our 44th anniversary.
Congratulations.
Thank you very much. Today NMC is well spread among around 9 countries, not only in UAE, the entire GCC we are in. We are in Europe, in Spain, Italy, Denmark. We are in South America, in Colombia and in Brazil, by way of our healthcare network. To UAE, the total number of patients that we treat, or incident that we treat is more than 4 million, of which majority of that comes from UAE. The business today, what we are trying to do is that whatever from the private sector, what we can connect to the innovation, that definitely makes the pursuit, the journey of excellence by the entire UAE means more meaningful. So we have tied up with possible regulators like DHA, Health Authority. We have been working with the big provider like Daman Insurance, how to make sure that the money is meaningfully used to ensure that there is sustainability on the healthcare platforms that we have created.
And have you been involved? So Dr. Osama mentioned the innovation strategy within DHA. So as a private sector healthcare provider, do you work with government helping them shape their strategies on innovation, for example?
Of course, especially with DHA, we currently work with the DHA on the strategy of the blockchain technology, which I think in the entire global healthcare, this may be the first of its kind which use blockchain technology, whereby it's a journey towards unifying the entire medical records, which will also help us to improve the entire healthcare indices of the country. We also work with the Abu Dhabi Health Authority on the Jawda scheme.
So the Jawda, that's their benchmarking index, isn't it?
Exactly, the benchmarking
across all of Abu Dhabi's hospitals and
we also
clinics.
We also try to work with institution whereby we can do the cross referrals and making it things more cheaper and more affordable to the entire system, and that brings in more people into the network of healthcare.
Okay, so welcome.
Thank you.
So we have a panel, we have someone from the insurance side, we have someone from the government regulatory and delivery side, and we have a representative from the private sector. So hopefully we have all of our bases covered. Please get involved in the conversation. We're here to talk about improving health and lifestyle and healthcare in the UAE. So all of your input is gratefully received, and I'm sure many of you have questions, so please take the opportunity, send your questions in, and we can move the conversation on and hopefully answer your questions. I think I'll start with you, Prashant. So we have this ambition to elevate the UAE up the Legatum Prosperity Index, but as an international company, how good is healthcare in the UAE at the moment? Does 28 reflect where we are in the world? I don't really know what that means. Would you say, where are the strengths and weaknesses? I'm somebody who has been involved in the healthcare industry for some time in the UAE, and I'm very proud to say that the journey of UAE in the last 10 years, from 2007 to 2017, has been amazing. The way in which regulator like Health Authority of Abu Dhabi, Dubai Health Authority, DHA creation, insurance company like Daman coming in, the mandatory insurance rolled out in Abu Dhabi and Dubai are all are real milestones in the entire healthcare industry. Presumably coming from a developing industry or a nascent industry, you can make great strides quickly, but as you get higher up the rankings, the incremental improvements become more difficult. Where do you think the challenges are today?
I think, I will just go into zooming into what are the major areas where UAE would have scored lesser compared to its competitor in the world in the Legatum Prosperity Index. When I look at it, there are three areas. One is the life expectancy.
Okay.
The two is mortality. Three is that how are we managing the burden of diseases like diabetes, obesity, and cancer? How are we managing it? These are the three areas where we scored lesser compared to many of the competitors. Very interesting numbers.
So life expectancy,
mortality.
Do you know off the top of your head what the
life
stats
expectancy in UAE is around 68.3.
Okay.
Whereas there are some competitors like Japan, which is at 87 or something like that.
And mortality rates, is that infant mortality or?
The overall mortality. So there are 30% of the people who die because of cardiovascular diseases.
Okay.
There is another 18% of people who die because of cancer. So there are 99 people die out of every 100,000 on cancer. So when you really, when you look at the entire table of Legatum Prosperity Index, one thing which really astonished me was that look at a country like Singapore, which in many means are getting compared to Dubai, to the way in which infrastructure has been created, a population almost like 70% of UAE. And when wealth prosperity, they're also one of the top in the world. Singapore doesn't come into the top 10 ranking of the entire Legatum Prosperity Index, but they are number 2 when it comes to the healthcare subdivision.
They're consistent across all of the different metrics.
Exactly. So they are 19 in the world when it comes to LPI.
Okay.
But they are number 2 when it comes to healthcare as subdivision of the index.
So in terms of this index and the ranking, the UAE's got a spiky performance. There are areas of high achievement and then some weaknesses, and the three that you've just highlighted.
Exactly. So if you look at it, the wealth perspective, the social well-being, we score much higher than many of our competitors, but we are scoring lesser in some sort of areas like healthcare, where definitely government is really focusing on it to make sure that we score in the top 10.
And Daniel, does that you agree with that sentiment? There are areas where the UAE has got a good record, but there are these kind of highlight areas that need to be focused on.
Yes, I do. I think in terms of access, over the last 10 years, the UAE has taken enormous strides. So with the introduction of mandatory healthcare, many people are able to access healthcare. They have a wide spectrum of choices. Cost has grown quite substantially in those 10 years as well, but when you compare it to competitors around the world or other countries, it's not necessarily that high, especially when you look at some place like the United States, for example. So doing quite well on access and cost in some areas, but on quality, I think there's, again, the record is good and bad. So the improvement, you see a dramatic improvement over time, I think, but still some areas that need a lot of work, and other areas they're doing quite well. So you have some centers of excellence, and the challenge, I think, going forward is to figure out how to build up other centers of excellence and maybe drive more business or more patients to those areas that are really excellent.
And Dr. Osama, from a government point of view, before we move on to the innovation, just to complete this conversation about the challenges, where are the focus?
I think that the new strategy of DHA answered a lot of these questions. So if you look into the new strategy of DHA, which has 13 pillars, one of the pillars was talking about new care models, and they were specifically concentrating on preventive care. This is one of the key issues that we need to work hard on.
So preventive care, this is about, is it lifestyle?
So this is part of lifestyle, and also trying to put this first gate of care. So we're talking about primary care. So we need also to work more on the primary care, because if you compare the primary care and the secondary care provision in UAE and in Dubai, you'll find a lot of investment in there in secondary care, but we do not do well in the primary.
So secondary care is in hospital care.
Yes.
And primary care
but primary care we don't have this strong. So comparing with UK, for example, we don't have this first gate of. So if you have a chest problem, you go directly to a cardiologist, which is wrong, because this is not the best way of utilizing the healthcare system. So we need to work on this. one of the key issues as well that we need to work on, not from the only the healthcare perspective, but even from the legal framework perspective, is mental health. So now Dubai is working on a framework for mental health, which includes a lot of it on the regulatory side and the legal framework.
So, and what does mental health cover? Is that things like depression and kind of stress-related health issues?
Yes, exactly. So these also one of the core pillars in the strategy as well is talking about the connected care. So now we have a very ambitious project around health information exchange, where every patient can have one record across the city and eventually across the UAE. So whenever you move from hospital A to hospital B, your data will follow you.
So broadly, before we go into the detail, broadly the focus from the DHA point of view is on primary healthcare and what the healthcare authority can do to stop people coming into hospital. Okay. So we'll now move on to getting into some of the detail about innovation. What is innovation in the healthcare sector? How can it be applied? Is it technology? Is it data? Is it communications? Please get involved in the conversation. Send in your questions to the panelists. We have insurance, we have government, we have private sector, and I'm sure you have expertise that you can bring to the conversation as well. So we have some questions already. Thank you. Keep them coming. I think before I go to the questions, we'll just have a little bit more of a conversation about moving on to actually what can be done or what you are doing. And so I'd like to start, Dr. Osama, with you. You mentioned the DHA's innovation strategy. You said there were sort of 13
So this is the transformation strategy, but innovation is a core
So what are we, it's obviously a massive document, so we can't do the whole thing, but broadly, what are the sort of the things, what are the innovation areas that you are looking at? So artificial intelligence, big data.
Yes, so we're talking about the innovation strategy. So we focus on certain areas. One of them is artificial intelligence, of course. So we need to develop algorithms that can support even consumers to do the first gates of healthcare. So instead of going to hospital directly, we get some sort of an app that can support you.
So this is about primary care online.
Yes,
you can
exactly.
pre-diagnose or...
That's right.
And where are we today on that service?
So actually, because now what we are trying to do is we are establishing what we call the Innovation Center of DHA, where we are going to incubate SMEs who have these kind of innovative ideas. So
really?
We bring them on in our incubation center. They come up with their ideas, so they could be university students or small, medium-sized companies. Then we work with them in kind of a joint venture to develop this. And this innovation center is going to be open very, very soon.
So if I have actually been at some conferences recently where I have met people who are producing apps for the health sector. If they want to get involved with DHA, what do they do?
So they have to contact DHA innovation team, and we are ready to incubate.
Okay, and what you provide is an incubator, a facility, premises where they can...
Yes, exactly. Very soon this will happen.
Okay, and what else is in the innovation strategy?
So part of the innovation center, what we call new care model. So as I told you that now we are trying to have new ideas on how to deal with patients. So rather than bring them to hospital, maybe we can push some of the efforts to home care, for example. So home care is one of the key pillars in our innovation strategy. So maybe we can send nurses or social workers or health workers to home rather than bringing a patient to the hospital.
Your job title is Head of eHealth.
Yes.
And what I think I'm hearing is that partly it's about the communication, the sort of openness of the network.
Yeah, exactly. What we call the Health Information Exchange. This is a project called NABID. So NABID has already been launched as a concept in February 2016. And now we have a very massive tender around it. And we're expecting it to start by early next year.
Prashant, if I can ask you on the private, so NMC, you have 9 facilities in Dubai, did you tell me?
Yeah, overall we have 48 facilities, of which the entire UAE has got around 31 facilities.
31, sorry, my mistake. Where does innovation fit into a private sector operator's mandate? You know, what do you look at?
See, as we discussed, as Mr. Zama said correctly, we need to really connect to the people, and that connect happens from the primary healthcare. The people should start using family physician, have to go into the center which is next to your community. That definitely will make sure that the patient get the right, information that is needed, and there will be somebody who can handhold the patient towards that. But that journey is longer for a private sector. We have taken certain, maybe looks very simple initiatives.
Why is the journey longer?
The primary health sector is not, from a financial business model. Sometimes it may not be the right journey. You can have in certain location. For example, we also hold some 8 or 9 centers like that, but it cannot be a widespread that you can create it.
So because of the level of investment required.
Right.
For a
The
private
return.
company,
To
it's
get the
better
return
to
on
invest in a
investment.
hospital or something.
No, not only that, the community, the number of people, the footfall that you needed
Right.
to make sure that you develop and generate that.
So sorry to interrupt, for what you're needing then is an integration with the primary
Exactly.
facilities from the government sector.
Exactly. So, that's what I was trying to say, that we try to work along with the government sector, whereby how we can work together on it. There are solutions where there is no need of infrastructure to be connected to both of us. One of the very good innovation that we have done, which again going back to the LPI, where we talk about the mortality rates, UAE's biggest killer even now is one of that is the road accidents. How can we work as a private sector seamlessly with the government initiatives to make sure that this mortality rates has to come down? Today we are talking about UAE from the wealth index, from the social well-being, from the infrastructure, much above many of the countries in the world. Why should somebody die on the road because they didn't get the right treatment at the right time, when the healthcare industry has really matured in a country like UAE?
So how does innovation help that? I mean, so that's about getting somebody to the accident spot quickly,
Right
and then
time.
getting them from there to the
Exactly.
doctor
So that,
quickly.
yeah. So how will you make sure that the ambulance reach the patient on time?
Yeah.
How will the ambulance driver identify which is the right hospital on time? How will the hospital be ready with those things to get the patient the right treatment? How, in case if the patient goes into a cardiac issue, how can you give him the first aid at the right moment? So it's a composite solution that is needed. It is healthcare is not like a quick fix like how it happens in a financial sector or on a commerce sector. It needs a complete solution that finally which has to be accepted by the medical fraternity.
Okay, so what does that? If I break that down, what does a complete solution mean? Does that mean, as Dr. Osama talked about, is that a communication network?
Communication network.
Or is it better infrastructure, or what does it?
It's a combination of all. For example, like it may be an app, simple app. That, for example, we are very happy to note that Dubai government is working towards a heart safe city concept. So wherein the entire, or like the one which we work with Dubai Health Authority on an ambulance, connect with the ambulance system of the Dubai government, whereby there is an app that should work between the hospital, between every citizen who is, or the resident of the UAE should have been able to give that particular information through the app to the center, which is the back office, which automatically give the signal to the ambulance provider to pick which is the ambulance available next to that patient.
So is this a kind of
Telecommunication.
online 911,
Yeah,
if you like,
yeah,
where
exactly.
instead of making a phone call and saying there's been a car crash
Exactly.
on Sheikh Zayed Road, you go onto your app and
Yeah, to
Say,
an
"I need
extent,
help."
where the new concept of camera coming in the car, where automatically it generate the signal that something has happened to the car in
Okay.
this particular point. That's the new concept that is coming in.
So who needs to make this happen? So you have obviously the regulator and the government, you have the healthcare provider. Who else needs to be involved? The car manufacturer?
No, I think the in UAE now we are working on it as a compulsory thing on the camera to be connected to the cars. You need the telecommunication industry to come in. So we are currently
Etisalat or
working
Do
with
or-
DHA and Do on the blockchain. So so you need a maybe the municipality has to work along with that. I saw a white paper on the Dubai Heart Safe City. More than 21 institutions are working along with that. And from there to a simple initiative like the government's initiative of Ministry of Happiness. I'm just take one clue from Osama, talking about the mental health happiness, the mental health of the people. If you really look at it, the Legatum Prosperity Index talking about the joyous they rank on joyous, they also rank on sadness. So you need to really go into that and get it, and I'm sure the Ministry of Happiness Creation, whereby will definitely help. So in that, you are bringing an ecosystem whereby non-healthcare, private and government institutions also coming and pitching in and giving what they can to help the entire mental balance of the people.
Okay, so joined up, bringing together people who previously haven't been necessarily involved in health or don't consider themselves healthcare.
Exactly.
So innovation is partly about building new communities or new ecosystems.
It's a good ecosystem.
So this also includes connection with non-healthcare, as he said. So for example, for some patients, sometimes the treatment is not medication, maybe just to make sure that you have the right food in his fridge. So this will we need to connect the social system with the healthcare system.
So does this bring in the Internet of Things, where the fridge can tell you?
I'm not talking about this, but I'm talking about the social workers who work with the social medicine.
Okay.
So we know that this patient needs some social care to support his health. This is another way of doing things.
Okay, now Daniel, if I can come to you before we go to, we have so many questions and keep them coming. Thank you for your questions. From an insurance company point of view, then, what does innovation in the healthcare industry or sector mean for an insurer?
So one of the primary initiatives we've had around innovation recently is trying to measure quality of providers, hospitals and doctors, and trying to use that as a better way to understand performance and then in the long run pay hospitals based on their performance. So in the past, prices have been set more on negotiation terms, depending on market size of the provider or the payer. But we want to move that more towards an evidence-based system where you pay a provider based on the quality outcomes that they have.
So does this mean, so an insurance company insurance is all about risk and assessing the exposure, your financial exposure, and in the past it would be what sort of percentages, and now you're trying to get much more detail about the quality of the service.
Right. We're trying to understand, one, we care a lot about our members and whether they're getting quality care. So that's really the first driver, understanding what are the outcomes for them. Are there better ways to achieve the same thing? Are there more efficient ways to achieve the same outcomes? And then using that as part of how we develop the network. So there may be some very good, excellent service providers who are also very expensive. You get nearly the same quality and you drop down a significant amount in cost. So you can stratify your network. Somebody wants to pay a higher premium, they could access the highest quality. If they're willing to pay to accept something that's nearly the same, but for half the price, they can also make that decision. So it really, it informs a lot of decisions.
So in terms of delivering change or delivering innovation, what does that mean? I understand the logic that you want more precise data, but what does it mean in terms of changing culture or systems?
Well, as soon as you start to measure something, you see an immediate change in performance, whether you're measuring overutilization or whether you're measuring outcomes, good or bad. So we see already, we've been measuring now for the last 2 years, and we can see an increase in the trend in terms of fewer readmissions across the board, fewer complications. So I think as soon as you shine a spotlight on behavior and people understand that there's a KPI behind it, then they begin to, the payment mechanism motivates providers also to perform better, and so that's really what's behind it.
And I guess from my perspective as an outsider, there seem to be sort of three parts to that which are challenging. So the first would be the data collection, actually getting accurate data, which is always difficult. Second would be data analysis. That's a skill in itself, isn't it? To actually, all this data, how do we turn it into value? And the third would be regulation, actually, the availability and security and transparency of data. Are those the kind of three areas?
Exactly. So, of course, without data, you can't measure anything. So, I think Abu Dhabi was very innovative back 10 years ago when they started off with e-claims, right? So the government mandated e-claims from the beginning. So immediately you have electronic data to work with. Once you build up a critical mass of that and you've built an infrastructure that can analyze it, then you can really start to do some interesting things. Daman went through a long journey and maybe about 5 years ago reached a point where they created an intelligence department which was specifically focused on data, began hiring data scientists and engineers to build tools and to build apps and to understand performance.
So you as well as doing the data analytics, you're building tools to
That's right. So we have a department called digitalization,
analyze, yeah.
which is focusing on improving the apps that we have and also looking at other ways that we can connect better with our members, right? Ways to directly, a lot of our business is to corporate, so it's about trying to connect directly with our membership, understanding what their needs are, and be more responsive there. So a lot of the innovation we do on the digital space is around interaction with customers.
Okay. Right, so we are halfway through the program, so take a breath, sit back. We have a lot of questions. I'm going to move on to the questions now, and I hope we get through them all. So these aren't any particular order, but this is for you, Daniel, the first one. So how would demand value an innovative initiative? So I guess what criteria is used to pilot fund an innovative initiative? So in terms of, I think this is coming from a hospital chief executive, so I'm guessing if a hospital is introducing an innovation, how does an insurance company look on that as, how do you price it, I guess?
Right, I'd say it depends on the impact on our primary stakeholders. Obviously, we're owned by the government of Abu Dhabi, and a lot of the funding comes from the government of Abu Dhabi. So the impact on cost would be one of the most important things, right? How can we make sure that we're being efficient with that money, not just saving money, but being more efficient with the money and getting better value. So that would be one of the primary motivations for assessing it. The other one would be our membership as well. So is it going to be good for our membership? Does it contribute to better lives, better health care for them? And then I'm sure as a commercial company, we also have a bottom line. We want to see if it's going to be good for our profit as well. But that would be, I'd say, third on a list of other stakeholders.
And if you are introducing an innovation, do you talk to the government or the insurance companies about how that will affect the relationship?
Definitely. I think a healthcare institution, private institution, cannot bring any innovation unless we get the proper blessings of the regulators and the insurance companies. And one thing which I definitely am very happy is that it's a very clear two-way communication process that has happened with the major insurance companies like Daman, or with the big regulators like Health Authority, Abu Dhabi, DHA or MOH. I've been very proactive in taking up such decisions.
Would you say, and perhaps Dr. Osama can come in on this as well, the UAE is in global terms is good for open communication between providers, regulators and patients, or is it still got challenges?
No, definitely. It's a very open environment.
I mean, compared to America or Europe or something?
We have experience in South America and Europe. Compared to that, definitely, it's a very open system. We have multiple meetings at multiple levels with the regulators and insurance companies on a very regular basis. For example, my medical team definitely will be talking to the medical team of Daman, where regulatory team talks to the regulatory team, and then there is a good exchange of ideas happening. And the regulators really help us to identify those gaps in the market where private could pitch in and give that. They will also come proactively to give ideas there where we could invest in order to support the demand supply gap, at the same time makes it feasible for a private sector to invest in.
And Dr. Hassan, what is your perspective on this relationship between, as we hear more about public-private partnerships and...
I'll give you just one example. Like here in Dubai, maybe in UAE, we are very lucky to have so many channels to push all these innovative ideas and make them projects just maybe in one day. So for example, I give you an example for the NABID project and the Numer project, which are both the health information exchange for UAE and for Dubai. The idea just started from one doctor who got the chance to speak to Sheikh Mohammed in December 2013, when he assigned one day to receive the ideas about healthcare and how to improve healthcare. So just one idea, and she got there. Sheikh Mohammed said that this should be a project, and that's it. Right. Now, even when we're talking about the Dubai government level, so we have what we call the Dubai Future Accelerator. So this is a program which has been running for maybe 12 months for 2 rounds. So this is a platform where we can accept SMEs and companies who have ideas and they want to push it for Dubai. Also now there's also a new platform what we call 10x. So this is also a platform for companies who want to test futuristic ideas that can be implemented maybe 10 years later. So we have different platforms that allows to adopt these ideas, test them, and even push them to the market.
And so I asked you about the private-public sector relationship. One other thing that's possibly a little bit unique to the UAE, because it's a federal or it's a federation, so you have multiple authorities.
Yes.
And in my experience in the Innovation Live initiative that we've been running for a couple of years, one of the challenges that comes up from a UAE perspective is the different governing bodies, so DHA in Dubai or the Healthcare Authority of Abu Dhabi, the Ministry of Health. How, if you have an innovation strategy here and the Health Authority of Abu Dhabi have their Jauda benchmarking index, how much communication?
Yeah, but still we map to a higher level strategy. So we have the UAE innovation strategy for sure. We have some projects that we work very closely with each other. Like for example, for the licensing now, they have established a higher committee to look into licensing regulation across UAE. So there is a very strong coordination.
So there's a sort of hierarchy of
yes. So
Yeah,
I
now
can
doctors-
think of
now
it as
doctors
a
can-
federated model rather than just separated islands.
Now doctors can move around between
Yes,
between the Emirates. You know, there's a big initiative.
Okay, and then I mean, you mentioned the HeartSafe initiative, which is a Dubai initiative. But if someone has a car crash in the border area with Abu Dhabi or something, does the initiative go across?
No, this is a
hospitals?
Dubai government's initiative. You know, which is currently on a white paper and going on.
Okay.
It'll be. I'm sure that it will be taken
It'll
up.
spread over
Yeah.
time.
For example, you know, we also have done something recently, which will help us to go out even, in the entire UAE as well as to the remote areas of UAE, whereby we are establishing an EICU concept, whereby the ICUs don't have to be manned, physically. It can be manned remotely. So this is this will definitely help.
That seems a bit counterintuitive. Intensive care means you have people there. How
You'll have nurses and others who will, definitely dispense or take care of the patient need at the time. But the intensivist will be on remotely controlling and giving the care. Because today it is impossible for the industry to have 24/7 intensivist available. That is making it more costly.
Yeah.
The entire system of ICU, and it will not yield, to the insurance company, and healthcare insurance company will find difficult to fund it. So these type of initiatives are well blessed by the regulators. That gives the strength to providers like us.
Okay, so if I'm going to move quite quickly now because we've got so many questions. But for you, Prasant, how do you see the role of technology and telemedicine in preventative care and home monitoring in the UAE? And are there regulatory challenges in adopting it?
So I think, the telemedicine is something which definitely we don't have, it's not a regulatory challenge. How do you get it financed? It's not very clear at this point of time to the private sector, though in Abu Dhabi we have seen Cleveland started coming and giving that particular care from Mubadala's investment in Cleveland. But when it comes to the other innovations, for example, like the other things, what they're mentioning about it, that definitely the private healthcare can pitch in a lot. Preventive healthcare, like more than 20% of the UAE population is today going through the diabetes. More than 20% having obesity issues, which are real precursors for lifestyle, your life expectancy, reduction of life expectancy, as well as mortality rates. So the way which we believe we can help into that institution is being a provider of a preventive healthcare, where there be a mandatory checkups for everybody after a particular age to go through on a diabetes or on the other indicators that helps to reduce the incidence of cardiovascular and other diseases. Abu Dhabi has come up with a plan named Vakaya scheme, which helps preventive maintenance to some extent. The another thing which we could definitely come in is on the cancer. Again, cancer is a big killer that is again increasing its presence in the market, in the region, and a lot of patients are going through the problem. Very good international statistics says that 1/3 can be reduced by just changing the lifestyle, and another 1/3 can be reduced by proper diagnosis. That will cure it. Only 1/3 has got fatal, which is like you have to leave it to destiny. then if you can able to reduce the 2/3, that would have been a big impact in the entire population of the country. It will help to improve our life expectancy. It will also generate more man hours. UAE is a very interesting country where you have a very big population falling under the age of 21 and 60. Even expatriates.
So if the question was about the application of telemedicine. So in terms of the point you're making about those obesity or lifestyle-related diabetes, lifestyle-related ailments, telemedicine
definitely will help.
Is about self-monitoring and getting that information. The second part of the question is about regulation of that
or the preventive care.
Regulation of preventive care. Yeah. What is your view on?
Yeah, that's something. So regulation of preventive care, the government is taking initiative like Vakaya, what they take in Abu Dhabi. Definitely, regulators have to make it more compulsory. More than regulators, I think insurance companies will be able to make it compulsory, whereby that such preventive maintenance, preventive care that we need to do that such schemes should be cheaper enough for people to afford also.
So it cannot be care that's about your lifestyle.
It could be like testing, diagnosing. Once in a while, somebody has to go through a blood test to identify the blood diabetes levels.
So the insurance company
will not be able to afford to give. Yeah, the insurance company will not be able to afford to give big money. They can subsidize something to the private sector. Private sector also come in, but private sector, I'm talking about the larger private sectors, only can definitely enter into that because that is not a big money maker. So only big private healthcare providers can work along with insurance companies to give that type of preventive.
Okay, thank you. I have a question, Dr. Osama, for you. I understand that the DHA has been collecting clinical quality indicators from hospitals and clinics for about 2 years. When will these indicators be published or made available to consumers?
Well, I think that we have maybe 2 or 3 departments working on this. Actually, now we have a new project around to automate the process. So all these indicators now are provided through the e-claim system and also through reports, manual reports that come through Excel sheets from all hospitals. So the project now, the RFP is already launched, and I think the project will be up and running early next year. This is what I understand.
Okay, and what will we see as consumers?
So you will have a ranking of hospitals based on their quality on certain specialties. Yeah.
Okay, so that'll be a little bit like the Jauda
yes,
thing. That's
same like Jauda benchmarking.
Okay, so I hope that has answered that question. If you have a follow-up for Dr. Osama on that particular point, if you send in your follow-up question, and we'll try and give you the full answer. Daniel, I have a question for you. How has and this question is coming from a government e-health person. I won't name names, but similar. I think a similar type of job to Dr. Osama's. How has your experience been with the Abu Dhabi Telemedicine Centre so far, particularly when it comes to member acceptance and adoption? You might have to give us a bit of background on what this initiative is. Can you share some utilisation rates and outcomes in terms of financial savings and clinical outcomes?
There is a telemedicine center in Abu Dhabi. It's Mubadala Asset. Was set up a few years ago, and our members do have access to it. I myself don't know the numbers in terms of cost savings, or there it is being used, and it does, where possible. The clinicians there can assess the issue and recommend whether they need to be referred to a specialist or not. So I know that it's working like that, but I don't have any specific statistics on it.
So if any of you are involved with Daman or with the Abu Dhabi Telemedicine Centre and you have some stats, please feel free to send them in and we can try and answer the question more fully. How can healthcare, this is a general question I think to all three of you, we will see how the question goes before we decide who answers. How can healthcare providers close the gap between patient expectations and reality? How can the trust gap in the private sector get closed where in many cases there's lots of unneeded diagnosis? So this is perhaps one from the insurance point of view as well. And excessive medication. perhaps over, what do you call it, a prescription of antibiotics, for example, or something. Prescribed to increase revenues of primary care in the private sector. So we've got two questions. One is this one about how can healthcare providers close the gap between patient expectations and reality. So,
sure, I can tell you quickly what we do at Daman. We started measuring utilization from facilities and from clinicians about 2 years ago. Looking at, and we try to do it using data, big data, to understand what's a fair benchmark. So we compare peers. So we only look at specialists. We compare a specialist endocrinologist with another specialist endocrinologist. And we even look at the diagnosis of the patient. So we're comparing similar patient case mix with the same specialty and create a benchmark for that based on all the data that we have in Abu Dhabi and Dubai, which is substantial. And then measure their performance relative to that and create an expected behavior and compare that to their actual behavior. And then draw the range of deviation from that. Some would be above, some would be below. And anyone who exceeds the 75th percentile, so these would be the worst or the top 25%, get warnings. Just a letter that says, look, we've noticed this behavior. It doesn't appear to be appropriate based on our analysis, but we invite them to come in, give an explanation for it, and we can accept the explanation if the medical doctors think it makes sense. Otherwise, we expect the behavior to change, right? And it's true, a lot of this behavior is financially driven. And we see dramatic changes. Simple warning letters or notifications of concern immediately lead to changes in behavior and some substantial savings.
And presumably, Dr. Osama, you talked about the initiative to benchmark outcomes. Presumably, have you seen do you work with the Jauda one in
We do.
And does that make a difference in these issues?
Right, so Jauda is sponsored by the Health Authority in Abu Dhabi. It's mostly self-reporting data, so hospitals report directly to the Health Authority and they compile a score based on that, which they'll be sharing quite soon with insurance companies.
And so the initiative that Dr. Osama has talked about in Dubai Healthcare Authority, that's the same.
Yes.
It's the same concept,
right? And eventually we will publish data to the public so they can know exactly which hospitals are better in certain specialties. And this will support their decision. So rather than just talking to friends to get recommendation, you get some evidence-based data.
And I don't know enough about who the Jauda system is aimed at, if it's the consumer or the medical practitioners. The question here was about consumer expectations. Yes. So these things will be easily available to me or to consumers. So I can see how this hospital performed or this doctor. And
yeah, I think in the long run, that's certainly the plan. One of the key issues you have to work out when you're measuring quality is to make sure that you're adjusting properly for risk, right? So that's one of the things we built in from the beginning in terms of our own measurement from claims data, the risk. So public hospitals tend to score poorly at first if you just look at outcomes. But when you start to compare what was the condition of the patient when they entered the hospital in the first place, their outcomes become much better. So that's really key. So before you can start sharing the data, you need to make sure that it's completely fair and reflects reality. So consumers really have to be discerning when they read these. I'm sure the government will be careful when it publishes this data, and we ourselves take great pains to make sure that it's a fair comparison.
Yeah, but this overdiagnosis, when it comes to overdiagnosis, of course, there'll be regulatory surveillance, there will be insurance surveillance, but we believe, being here for last 44 years, it should be self-surveillance. It should come from the organization, that what is that we are going to do, and how can we ensure that the entire system doesn't get manipulated to only get the financial gain. We have around 1,400 doctors working with us. We have all the doctors working with us, like full-time salary doctors who doesn't get a revenue share of doing something else. And we also put specific indicators for the doctors. For example,
again, I don't know enough about the detail of this, but over prescription or over medication,
exactly.
Is that
it's a big issue.
Is that driven by financial motivation, or is it because there's a culture of the patients like to go away with some solution?
It's a combination of various factors, but end of the day, in an environment where we are all talking today, I'm not talking about 10 years, 15 years down the line, but we are all used to a system whereby doctor is the ultimate word in that particular exchange of information that happens in the doctor's chambers. Nobody else can change the thought process of the patient. So we put internally some sort of a strategy, measures to them, that what should be our total pharmacy billing to the total billing that happens, or like how many of our patients who walks into the pediatrics will not have antibiotics. So we put some, or like the number of C-sections we have on the total number of, how can we reduce the C-section to the total number of deliveries happening in, as a specific target along with that to the doctor. So we have divided our entire portfolio of business up to me as a CEO. Below me there are two power points for us. One is the Chief Operating Officer, who takes care of the operational initiative of the business. We have a Chief Medical Officer who takes care of only the medical or the clinical aspects of it. There is a push and pull happening on that end. If there is no proper internal check and balances in the system, any healthcare industry can definitely slip into that type of overdiagnosis, which will definitely affect the entire population.
So you have some targets or some numbers that you would see as a normal pattern, or where you should be a bit like
exactly
Daniel's description about, and I guess it ties in with the whole benchmarking. Do you do it just within the NMC group of hospitals,
exactly,
or can you go beyond that into international standards and wider?
We have an analysis of that. That's what we know. We have a team that works on the quality departments team. We have a quality strategy team that fully works on not only comparing the UAE peers, but also going into the healthcare developed economies in the world. Okay. How do that pattern works in that particular place?
So for C-sections versus
to the normal
delivery, you can compare.
It's not a fully comparable, because you look at UAE as a country, we have like 200 nationalities living into that. So there is a genetic disposition to many of those treatments. So we need to really, as Daniel said, you cannot compare apple to apple. There's no comparison of apple to apple in healthcare. So, but we can only give some sort of a benchmark, some sort of a bandwidth on which they need to play, depending on the medical situation. But the clarity should come from the top to down in healthcare industry, that the intention is to make the entire industry sustainable, and to ensure that the ecosystem where patients, providers, and the insurance provider, regulator, all works in tandem to the ultimate goal of achievement of the best healthcare indices.
Okay, thank you. Now the questions keep coming, so in no particular order. We have here somebody who is, I think I would describe them as a cynic. So you have a job on your hands to answer this question. Could the entire panel describe a specific project, not a concept, that is an example of innovation across the entire UAE, not apps that don't exist, big data where there isn't even a cancer register. So basically this person says nice words, but what's actually happening? Perhaps Dr. Osama, you haven't spoken for a while, so I'm going to come to you first.
So
you've mentioned a couple of things already, but what's live right now that didn't exist a year ago, that's harnessing big data? Or
okay, so I think with regard to the Dubai Safest Heart City is a project which is ongoing now. It's already launched, so we started preparation for it maybe 3 or 4 months ago, and it's going very well, and almost we put the regulations for it. So I think I consider it as an ongoing project. This is speaking of Dubai as well. I don't know if in Abu Dhabi, I think they have also.
Sure. What I mentioned earlier, our payment for performance. So that's been in operation now for more than a year and a half, I think. The first year where we took it into account when negotiating prices with providers was in 2017. So we have a very robust measurement of provider performance, which is shared back on a quarterly basis with providers, and they've been receiving those reports for more than a year now. And as I said, trends are improving across the board in terms of efficiency and also in terms of quality. We've had great cooperation with a lot of the provider groups in Abu Dhabi. And they've built in-house utilization committees to try and understand, and quality departments. So that's really something that's ongoing. And the whole core of it is big data, right? Yeah. Understanding. And as I said before, it's easy to measure something, but to measure it fairly, that's where you really you need some data scientists to develop a proper risk adjustment methodology.
So I'm interested in this, the data scientist bit. I hear this. I mean, it's this big data is affecting every aspect of life and work around the world, and there's this need for data scientists, people who can analyze the data and order it. how is the UAE positioned, and particularly, I guess, for an insurance company, which is a lot about analysis? Are there enough data scientists around? Do we have those skills in the market?
There's probably not enough around, for sure. It's a difficult skill set to hire for. They tend to be expensive as well, so you need to have the resources to really be able to afford it. I think there are some universities in the UAE that produce some good data scientists. Masdar is one institution that I can think of where we've recruited from. So there's a pool of people, but there's a lot of competition for them. So really, it's about not just hiring data scientists, but training the people that you have in this skill set. So they may be an actuary or they may be a statistician, but you can bring some expertise in-house, which is what we did with our risk adjustment methodology. It was developed for us alongside a consulting firm. They trained our team how to use it and the methodology behind it, and it's now run ourselves. So we're not dependent on external support. And that's kind of a constant as trends change, as new methodologies appear. That's a constant kind of innovation you need to keep doing within the intelligence department or strategy department.
And Dr. Osama, for the DHA, what are the sort of skills you're looking for the next generation of regulators and health authority people? Is it
I think data analysts is the most wanted job for us now, because it's really centric to develop our futuristic strategies. We need to have like baseline, even if you want to put forward a new policy. You need to have a baseline of data to see where you are exactly, and to build a business, what we call a predictive model, to see to evaluate every alternative and then select the best one. So it's not easy to.
And for NMC, where are the resource requirements around innovation and taking healthcare forward? Is it data?
It's definitely data. There's nothing else other than data. We currently are working on creating an accelerator to help the best university students across the world to come and work, and how can private sector develop on it. We're also currently working with the New York University in Abu Dhabi to work on getting the best ideas that could come up, which can be incubated in NMC's platform.
This is I was at a conference recently when James Whittaker, who's the chief engineer for Microsoft, was speaking, and there was this topic about STEM education, science, technology, maths, and engineering, and big data analysts, and everyone. The received wisdom is that's where we should focus our skills. He disagreed, actually. This is an engineer at Microsoft. He said that artificial intelligence and bots will do data analysis faster and better than any human can, and actually it's the creative set that the human brings and so you've just mentioned about looking for new ideas. So it's that creative element as important.
Definitely, because the thing is that for any innovation to become feasible, it has to have a financial advantage of it. How can you reduce the cost? So reduction of cost is indirectly reducing the healthcare spend of the insurance company. It makes for regulators to understand, and identify how can we improve. So those ideas today are coming up from the world. So we are looking east, looking west. Both policies are going on from our side. We are developing an accelerator from India, which is again a country where comes a lot of ideas comes in the big picture of the world.
What does an accelerator involve? Is that you've got a fund set aside to provide financing for a concept?
It's a combination of that. It could be a financing side. It could be we use our platforms for them to come and develop their ideas. They can use our back office support. We can use all our support to them.
So if a research student has a concept, they can approach NMC
and they can use the information from our side. And if that is going to work out, we could participate on their financial plan, or maybe they can themselves grow in the world. So one on the east, we are doing it in India, and the New York University with their campus in Abu Dhabi, we are also working along with them.
Okay, congratulations. So another question here. Actually, this will be the last question, so I apologise if you've sent a question and I haven't been able to get it to the team. We will try and answer everything by email. We have to be very quick on this one then, and it's quite a long question. Many patients don't trust their doctors and tend to ask for second or third opinions. Would the app that you talked about be successful, successful in getting people not to go for second or third opinions? So if I start at your end, so this cultural change, I think, is the kind of part of the innovation story from the user end as well as the delivery side. Will these apps, will people trust them?
Yeah, I think it depends on how it's implemented, right? So I think what the regulator's interested is to make sure that if somebody goes for a second or third opinion, they've been referred, right? That there's, or at least that there's a good medical reason for it. Many people visit multiple doctors because they don't have confidence, or they're just worried, right? Maybe they shouldn't be. So telemedicine is one good intermediary here, which might help assuage some of that concern. So they could call a doctor. It doesn't cost the same as a physical consultation, but maybe it could just assuage some of their fears. The doctor can give them the referral if they need one. So it's about looking at other ways to structure the process to save costs, but also to maybe build the confidence of the patient in the healthcare quality itself.
So, Dr. Osama, do you think that one of the added benefits of e-health and going big data online will be it'll increase the trust in your first doctor's opinion and perhaps improve efficiency?
Well, I think this kind of trend will never stop. Even for me, every patient will need to get better or a second opinion. This is very natural. I think, as I told you, e-health can support this process. So it's about making much easier, much faster, much effective. Also, by having what we call the 360-degree view of the patient data as a whole, it will give even the doctor a better decision about whatever diagnosis that's required. So, because I'm sure that the doctor sees whatever data around me, he will make a better decision. So this will support some sort of a trust.
Okay, and finally to you, Prashant, the same question really. How will these innovative concepts, how will they change that, the culture, the behaviour of consumers and healthcare providers?
Exactly, it's very difficult to come out of this culture. As a human being, we are very much bothered about nothing other than the health of the particular individual. And then with the new technology coming in, like you can Google and find out any information today. We have, as I mentioned, we have 1,400 doctors. One of the biggest challenge that the doctor is facing when I meet them is that Google is their biggest competitor for the doctor, because the information with which a patient is entering into, maybe the medical knowledge is not sufficient for him. In maybe a right information, maybe a wrong information that is available in the internet is really bombarding that with the patient, and he wants to test everywhere. So it's very difficult. But what my view is that the unified medical records, whereby the patient goes in, and that will definitely able to identify the doctor's ability to identify. For example, a regulator or insurance company will later identify why the patient moved from one doctor to other doctor. So now we are talking about the jada of identifying and benchmarking the hospital. Maybe a point will come whereby we start benchmarking the doctors of the same profession, whereby is it because of the general inquisitive nature of the person who moves from one doctor chamber to other, or is the doctor was unable to really identify and sort out his problem? And also, exactly, I will again echo the same wordings of Mr. Osama, that the unified records will also help the medical interaction happening in the body of the individual, because he has got multiple diseases. Today we have too many streams of super specialisms, something like even dentistry, you walk in, you will have 18 types of specialisms happening in dentistry. So patient is completely sometimes confused, which is the specialism I need to walk in. And then that specialist is really focusing on that particular knowledge that he possesses. So maybe a general holistic view will come from unified. A primary care family physician who handholds may emerge out of it, which will definitely reduce the cost of provision of healthcare and make it more available for the people.
Excellent. Well, that's a perfect note to end on. We've come to the end of our time for this. I know that a lot of you have sent in questions and we haven't had the opportunity to answer them. We will try and answer them by email if possible, and perhaps we can set up a follow-up conversation and go into this topic further. I'd first like to thank my panelists today, Prashant, Dr. Osama and Daniel. Thank you, gentlemen. It's been a fantastic discussion.
Thank you.
This conversation has been part of MEED's Innovation Live initiative. If you want to get involved in Innovation Live, where we're bringing business and government together to look at innovation and the UAE delivering its innovation goals, you can contact MEED. Our next event is our hackathon event, which will be on the 21st of November, and this is together with our Innovation Live conference and exhibition. and we will be having preliminary water cooler discussions in our 7 vertical areas at the start of October. So if you want to get involved in Innovation Live, please contact me or my colleagues at MEED. Thank you very much to everybody from our Facebook Live communities, from NMC and from Innovation Live on Facebook. And thank you to you for joining us on MEED Live today. See you next time.